In medicine, there's a very important term often used. The 4Fs, fat, female, fertile, 40. These are considered classic risk factors for gallstones, and gallstones are a very important topic. Gallstones are the formation of stones in the gallbladder. Most people think of stones as something that happens in the kidneys, but stones in the gallbladder are different from kidney stones, so we'll need to go into more detail. We'll cover all aspects of this condition. The gallbladder sits right next to the liver, and its ducts connect directly to the liver. Its main function is to store bile, and from there it flows forward to aid digestion. Bile is a very important substance, and it's essential that you understand it. Bile is produced in the liver and helps in digestion. When there are issues with bile, they can lead to various problems. One of bile's key roles is to remove waste products such as cholesterol and bilirubin from the body. It also helps break down red blood cells, RBCs. As for why stones form in the gallbladder, one reason could be high cholesterol or excessive bilirubin, or sometimes it can be idiopathic, meaning there's no identifiable cause. Another reason is when the gallbladder doesn't fully empty, leading to stagnation and stone formation. These stones are generally of two types. Cholesterol stones, usually yellow, formed due to excess cholesterol, about 80% of cases. Pigmented stones, darker, formed due to excess bilirubin. As I mentioned earlier, the classic model of risk is the 4Fs: fat, female, fertile, 40. Additional risk factors include lack of physical activity, obesity, high-fat diets, certain oral contraceptive pills, diabetes, Crohn's disease, low-fiber, high-cholesterol diets, rapid weight loss, especially from crash diets or certain medications. Now, let's talk about the signs and symptoms. How do you know if you have gallstones? The most common symptom is pain in the upper right abdomen, right upper quadrant. This pain may radiate to the right shoulder blade or the back. You may feel nauseated, feel like vomiting, or experience indigestion after eating fatty food. You may also get acid reflux or heartburn. If the condition becomes complicated, you may develop fever, chills, or even jaundice, yellowing of skin and eyes. If you experience such symptoms and visit a doctor, the doctor may recommend CBC, complete blood count, to check for infection, LFTs, liver function tests, hepatitis B and C tests to rule out liver disease. The most important diagnostic test is ultrasound, which is considered the gold standard. If stones are suspected to be in the bile duct, further imaging like MRCP, magnetic resonance cholangiopancreatography, or endoscopic ultrasound may be done. Now let's talk about treatment. There's a lot of confusion. People say, just remove the stone, not the gallbladder. But gallstones aren't treated like kidney stones. If you have asymptomatic gallstones, you might not need treatment right away. In such cases, doctors may suggest lifestyle and dietary changes. However, if there are painful symptoms or infection, the entire gallbladder is usually removed. This is because the gallbladder's function isn't considered essential, and removing just the stone without removing the gallbladder isn't effective long-term. Surgery can be done in 3 ways. Laparoscopic surgery, keyhole surgery, most common today. Robotic surgery, open surgery, less common, usually reserved for complicated cases or previous surgical history. In some cases, medications like ursodiol may help dissolve cholesterol stones, but this treatment is limited and not suitable for all. If gallstones are not treated, complications may occur. Acute cholecystitis, inflammation and infection of the gallbladder. Obstructive jaundice, if a stone blocks the bile duct. Sepsis, a life-threatening infection that can spread through the bloodstream. Pancreatitis, if the stone blocks the pancreatic duct. These are serious conditions requiring hospitalization for antibiotics and sometimes emergency surgery. Now, how do you prevent gallstones? Here are the lifestyle changes recommended. Eat a high-fiber diet. Avoid fatty, fried, and processed foods. Limit carbohydrate intake. Include whole grains, leafy vegetables, wheat bran, etc. Consider adding fish oil to your diet. Exercise regularly, at least 5 days a week. Maintain a healthy weight. If you're taking oral contraceptives, consult your doctor, especially if you have a family history of gallstones. Lastly, don't lose weight too quickly. Losing more than 1 to 2 kilograms per month can increase your risk of gallstones. Gradual, sustainable weight loss is safer. This was a general overview of gallstones.